Hey everybody, it's Dr. Dyken from Spinal and Sports Care Clinic here with
Dr. Jack Choate.
The one and the only Dr. Jack Choate. I'm sure plenty of you have seen him. I'm a little newer, so you might have not seen me in the past, but we're just going to do a quick video. We're going to do a video on disc herniations. We want to talk about this topic because a lot of people don't know that we treat them, and that chiropractic is a great treatment option for disc problems. And yeah, we've seen patients who didn't know and then they got surgery.
I'd say a fairly significant amount of people that we see in our clinic are disc-related cases, both in the neck and low back, wouldn't you say?
Yep, I would say. Yeah. Actually, quite a few. I just saw somebody the other day, actually very sad. He didn't know we treated discs. He had a disc problem, and he went and got surgeries, several of them, and they all failed. And, you know, he is now taking a lot of pain pills every day, and they don't really help. And they're trying to do another surgery where they fuse his pelvic bones together. And to be honest with you, it probably won't help. Yeah. I don't see success with that kind of surgery. Yeah. When you have one failed back surgery, it just keeps going. Yeah. And he's probably never going to be out of pain.
Yeah, and someone who can speak from personal history of the family history of spinal surgeries, it's definitely the way to go is to avoid it if you can. So start with more conservative-based therapies, and then if you have to progress and work your way towards a spinal surgery, at least you can say you've exhausted all those treatment options. Yeah. And then, you know, if surgery will help you, so be it. I've referred people to surgeons, some of them with really good outcomes, actually. So it can help if they're screened properly, but more people should be starting here than starting at the surgeon's office, don't you think?
100%. I would. Why wouldn't you start with the more conservative, less invasive option? If it doesn't work, well, fine. That's okay.
You're no worse.
You're no worse off. If you start with surgery and it doesn't work, well,
you can't undo it.
You can't undo surgery. It's gone. It's happened. If they fuse your back, you know, those vertebrae aren't going to be unfused ever. So we really think you should at least give it a good shake of conservative care. One of the big things is there's a history of some sort of lifting or bending injury. You know, I was picking up something off the floor and my back went out and it hurts like crazy now. And I can't bend over without it hurting a lot. You know, I hear that a lot. Or I can't sit, you know, which sitting is you're bent when you're sitting. I can't sit for very long without significant pain. So generally, they're intolerant of bending forward, and they usually have a history of lifting injuries, and usually they have a history of episodes of low back pain, where the pain comes, they stop doing stuff that hurts it dies down, and they go back to normal life, and then it flares up again. And it just does that sort of cycle for quite a while until something really bad happens. And they show up at our door and they're like, oh, my leg is, you know, I've got this burning leg pain and my back is killing me. I can't stand up straight, but I can't bend over.
And mornings typically are pretty rough.
Mornings are really rough. Yeah. They're super stiff. It's like, I can't get my pants on. How many times have you heard that?
Can't get dressed. People are coming in wearing slippers.
All the time.
No lace shoes. That's really bad. Can't bend over to put on the shoes.
And generally it's, my wife or my husband had to dress me this morning. Yeah, I couldn't get my pants on.
And then maybe as the day progresses, things have a tendency to loosen up. You're working mobility into the spine, so things have a tendency to feel better, but sometimes they can also degrade toward the end of the day. The more you're on your feet, it starts to wear down again, and there's that recurring pattern again. Okay. Now, at the heart of the motion or the action of the problem for disc issues is the bulging or herniated disc. And so the anatomy of the disc, it's a two-part component. There's an outer ring that contains the gelatinous interior, and these are very tough rings that are under a compressive load. They're very resistant to compression, but they have a weakness, and that is with rotation and bending motions, they can be weak. So you can like compress and drop a piano on your spine, it's going to be okay.
But don't drop a piano on your spine.
Oh,
don't try it.
That almost happened to me the other day. So
really?
Yeah, no.
Okay.
It was all right, though.
Okay.
Pretty strong. But when you start twisting the spine in conjunction to bending, that's when those outer fibers, those cartilage rings, become weaker.
Yeah.
And then it can create a bulge where the material inside migrates toward the outside corner, and then you get a bulge and herniated disc, and unfortunately the nerve that it comes in contact with can become pinched, and then that's when you get the leg symptoms down there. Yep. So that's what we want to try to prevent. That's what we want to try to prevent.
So what would you do what would you say your treatment options are? For the classic sort of disc patient who comes in, like we talked about, they can't put their shoes on. They can't bend very well. Sure. A lot of them are really concerned about work because, I got to get to work, but I'm a plumber or I'm an HVAC technician.
Right.
I got to bend.
Right.
Well,
yeah, it's always a tricky balance to try to heal a condition but also allow a person to be functional and work over the course of the day, because life just doesn't stop all of a sudden when you get a raging hot disc that is interfering with your life. So our goal is always try to restore function, decrease pain as quickly as possible. Yep. So through chiropractic methods, we have a combination of exercise therapy. Yep. We have what we would use we call low force chiropractic care. So we don't always manipulate, crack the spine if it's in a lot of pain. Sometimes we just don't do that because that might actually make the problem worse. Yeah. So we use a series of low force instruments that are super gentle. I mean, we can use these on 90-year-old people that are brittle, and so they can handle it just fine. Yep. We can use a very neat type of therapy called spinal decompression.
Yeah, that one's really good too.
Therapy. It essentially is a table that you lay down either face up or face down. It very gently pulls and separates the disc to allow for a decompression mechanism to go into effect to reduce the size of the bulge of the disc. Yep. So it's quite comfortable. A lot of times people will fall asleep on the table. That's how gentle it is.
Yeah, people like it. It feels really good. That's the number one thing you hear is, oh, I could stay here for a while. Yeah. They have to get off. There's other people. But, and I would say, too, what we really focus on is we try to focus on retraining you how to move. You have to bend, but we can teach you how to bend in such a way that doesn't hurt. Yeah. And get up out of a chair in such a way that doesn't hurt. Get out of bed, roll over. And that's what we see that kind of lacks sometimes in treatment of discs is people do get better because the natural course of a disc injury is they're going to get better. But a lot of people re-injure themselves because they have no idea how to fix it. They have no idea how to stop hurting it. And I find, I know you do too, that if people keep doing the things that hurt their back, it takes a lot longer for them to recover, and they're going to be back in.
And a good example of that would be everyday activities, such as sitting. Yeah. When you sit, and if you slouch down and round forward, it's a known fact that increases disc pressure a lot more than if you sat with a support behind your lower back. Yep. You're still sitting. The only thing that's different is how you're sitting. Yeah, it's where that vertebra that's something that can easily be trained and corrected.
It's so easy.
And you multiply it by 4, 6, 8 hours a day for sitting, 100%. Times 5 days a week, you just save yourself a lot of grief.
Yep. You think you've got disc problems, and you've had maybe some imaging, an MRI or an X-ray or something, and you don't know if what we're going to do could help you, give us a call. We'll actually do a free consult. We'll do a free phone consult. You can get on the phone with one of us. We'll talk to you. We'll look at your imaging. We can pull it up on our computers, about 10, 15 minutes or so at the most, and we can tell you whether or not we think you're going to be a good candidate.